we try to take quite a proactive approach in identifying carers. So when a patient first registers with us, it's one of the questions we ask on their new patient health check, and when they fill in their new registration forms as well. With patients that we already know, the reception staff, because we're quite a small practice, have really good relationships with the patients anyway, so they kind of get to know them, and they know if the circumstances change and, you know, they are starting to look after somebody. And sometimes it's about actually helping them to realise that they're a carer as well, because often they just don't actually see themselves as being a carer. You know, for example, if it's a mum, you know, and their son is taking drugs, you know, and actually they don't see themselves as being a carer, although actually, you know, they're spending a lot of their time in doing that carer's role. So the reception staff are very proactive in trying to kind of identify patients in those ways. And we also have a carer's champion. Our reception team lead, Hannah, takes on that role. So she links in with Gateshead Carers. She's able to organise training sessions for the staff whenever we need them. And she just makes sure that all of the staff have a really good awareness of carers and how you can kind of signpost them to organisations that can help. The relationship with Gateshead Carers is so important to all of the practices in Gateshead. There are 30 practices in Gateshead, and I would say it's fair to say that most of them take a very proactive approach to identifying carers and being able to refer on to Gateshead Carers. So it's fantastic to have that support, and it's something that we really value, because actually it's not just a support for our patients, it's also a support for the practice. Often the GPs will struggle in a 10-minute appointment to be able to meet all of the patient's needs, but that's where Gateshead Carers comes in, because we know that we can make a referral and they will get all of the support that they need.